Welcome back. Today we're covering two fundamental resistance exercises that can help maintain and build strength after 60, wall push-ups and chair squats, also known as sit-to-stand exercises. These movements address the two most important areas for functional independence: upper body pushing strength and lower body standing strength. Both can be performed at home with minimal equipment. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new exercises, especially if you have existing conditions or concerns. Let me explain why these specific movements are valuable and how to perform them safely. Understanding age-related strength loss. After age 60, most people experience gradual muscle loss, a process called sarcopenia. This isn't inevitable decline, it's largely the result of reduced physical activity and insufficient muscle stimulation. Research shows that resistance training, exercises that challenge muscles against resistance, can slow, stop, or even reverse this process. The key is providing sufficient stimulus to your muscles to adapt and grow stronger. Walking is excellent for cardiovascular health, mobility, and overall well-being. However, walking alone typically doesn't provide enough resistance to maintain upper body strength or maximize lower body muscle growth. That's where targeted resistance exercises become valuable, not as replacements for walking, but as complements to it. The two exercises we'll cover today are well supported by research for older adults. They're functional, meaning they directly relate to daily activities. And they're scalable, meaning you can adjust difficulty to match your current capability. Exercise 1, Wall Push UPS for upper body strength. The first exercise is the wall push-up, a modified version of the standard push-up that reduces joint stress while still providing effective upper body strengthening. This movement primarily targets your pectoralis major muscles in your chest, your anterior deltoids in your shoulders, and your triceps in the back of your arms. It also engages your core muscles to maintain body position. Why this exercise matters functionally: these are the muscles you use to push yourself up from a bed or chair using your arms, to push open heavy doors, to lift objects away from your body, and to catch yourself if you start to fall forward. Many older adults gradually lose upper body pushing strength because daily activities don't require it much. Unlike your legs, which you use constantly for walking and standing, your upper body pushing muscles can weaken significantly without targeted exercise. Here's how to perform wall push-ups safely and effectively. Stand facing a wall, about 2 to 3 feet away. The distance will depend on your strength level. Place your palms flat on the wall at shoulder height and shoulder width apart. Your fingers should point upward or slightly outward, whatever feels comfortable for your wrists. Step your feet back until your body forms a straight line from your head through your hips to your heels. Engage your core by gently pulling your belly button toward your spine. This helps maintain proper body alignment. Slowly bend your elbows, allowing your body to lean toward the wall. Keep your elbows at roughly a 45-degree angle from your body, not flaring straight out to the sides, which can stress your shoulders. Lower yourself in a controlled manner until your nose is a few inches from the wall or as far as you can go while maintaining good form. Pause briefly, then press through your palms to push yourself back to the starting position. Exhale as you push. That's 1 repetition. Start with 8 to 10 repetitions. Rest for 1 minute, then perform a second set. Work up to 3 sets as you build strength. Practice this exercise 2 to 3 times per week, allowing at least 1 rest day between sessions. Key form points: maintain a straight body line throughout, don't let your hips sag or pike upward. Keep your core engaged. Move with control, 2 to 3 seconds lowering, brief pause, 2 to 3 seconds pushing back up. And breathe naturally, don't hold your breath. Progression options: if this feels too easy after several weeks, increase difficulty by stepping your feet further from the wall. This increases the percentage of your body weight you're pushing. If it feels too difficult, move your feet closer to the wall to reduce resistance. Safety considerations: this exercise is generally safe for most older adults. However, you should approach with caution or consult your healthcare provider first if you have significant shoulder problems, recent rotator cuff injury or surgery, severe wrist arthritis or pain, or significant balance issues that make maintaining the position difficult. If you experience sharp pain, not to be confused with muscle fatigue, stop immediately and consult a healthcare provider. Muscle fatigue is normal, joint pain is a signal to reassess. What to realistically expect? With consistent practice 2 to 3 times per week, you may notice within 4 to 6 weeks that pushing tasks feel easier, you have better control when lowering yourself into bed or a chair using your arms, your posture may improve as chest and shoulder muscles strengthen, and you can progress to more challenging positions, feet further from wall. What you should not expect: this won't dramatically change your appearance. It won't turn back time or provide anti-aging effects beyond maintaining functional strength. Results require consistent practice over weeks and months. There are no quick transformations. The goal is functional improvement, maintaining the strength to perform daily activities with confidence and independence. Exercise 2, chair squats for lower body strength. The second exercise is the chair squat, also called sit to stand. This is one of the most functional exercises for older adults because it directly mimics activities you perform multiple times daily. This movement primarily strengthens your quadriceps muscles on the front of your thighs, your gluteal muscles in your buttocks, your hamstrings on the back of your thighs, and your calf muscles. Together, these muscles control standing, sitting, and stair climbing. Why this exercise is particularly valuable: the ability to stand from a seated position without using your hands is a key indicator of functional independence and fall risk. Research shows that older adults who can't perform this movement independently have significantly higher rates of falls, hospitalization, and loss of independent living. A study published in the International Journal of Environmental Research and Public Health followed 200 adults over age 60 for 16 weeks. Those who performed sit-to-stand exercises 4 times per week showed significant improvements in leg strength, balance, and reduced fall risk compared to a control group. This doesn't mean one exercise prevents all falls or guarantees independence. Falls are multifactorial, but maintaining lower body strength is a crucial component. Here's how to perform chair squats safely and effectively. You'll need a sturdy chair that doesn't slide. The chair should be at a height where your thighs are roughly parallel to the ground when seated. A standard dining chair height works for most people. If you have significant mobility limitations, a higher surface may be more appropriate initially. Stand in front of the chair with your feet shoulder-width apart. Your toes can point straight ahead or turn slightly outward, whatever feels natural. Position yourself so that when you sit, you'll be centered on the chair. Extend your arms straight in front of you at shoulder height for balance. This is the starting position. Initiate the movement by pushing your hips back as if you're trying to sit down. Keep your chest lifted and your weight centered over your feet. Your knees will bend as your hips move back, but focus on the hip hinge first. This protects your knees. Lower yourself with control until your buttocks lightly touch the chair seat. The key word is lightly. You're not collapsing into the chair but maintaining control throughout. Some people find it helpful to barely touch the chair or hover just above it if they have sufficient strength. Pause briefly when you touch the chair, then drive through your heels and the balls of your feet to stand back up. Keep your chest lifted and your core engaged. Squeeze your glutes at the top of the movement. That's 1 repetition. Start with 8 to 10 repetitions. Rest for 60 to 90 seconds, then perform a second set. Work up to 3 sets as you build strength. Practice this exercise 3 to 4 times per week. Key form points: keep your knees tracking over your toes, don't let them cave inward. Maintain your weight on your full foot, not just your toes. Move with control in both directions, standing and sitting. Keep your torso relatively upright, don't fold excessively forward. And breathe naturally. Exhale as you stand, inhale as you sit. Progression options: if this becomes too easy after several weeks, increase difficulty by barely touching the chair or hovering above it rather than sitting fully, slowing down the lowering phase to 4 or 5 seconds, or using a slightly lower chair or bench to increase range of motion. If it's too difficult initially, that's okay. You can make it easier by using a higher surface like a countertop or tall stool, allowing yourself to sit fully between repetitions with a brief rest, or using your hands on armrests for assistance initially, gradually reducing reliance on hand support. Safety considerations: this exercise is generally appropriate for many older adults, but caution is warranted if you have severe knee osteoarthritis or pain. Consult your doctor about appropriate depth and modifications, recent knee or hip replacement surgery. Follow your surgeon's and physical therapist's guidance. Significant balance problems: ensure you have a stable support nearby, or lower back pain. Focus on proper hip hinge technique and don't round your spine. Always have a stable surface nearby that you can use for support if needed. Practice near a counter or sturdy furniture initially. What to realistically expect. With consistent practice 3 to 4 times per week, you may notice within 4 to 8 weeks that standing from chairs feels easier and requires less effort. You have better control when sitting down, stairs may feel less challenging, your balance during standing activities may improve, and you may notice increased muscle firmness in your thighs and buttocks. What you should not expect: rapid dramatic strength gains. Muscle building takes time, especially after 60. Complete elimination of all difficulty with these movements if you have significant arthritis or other conditions. For pounds of muscle gain like the study mentioned, that was with a structured 16-week program and may not reflect individual results. Guaranteed prevention of falls: while this helps, fall prevention is multifactorial. The goal is gradual, sustainable improvement in functional capacity. Creating a simple routine. Here's how to incorporate both exercises into a simple twice-weekly routine. Day 1 and Day 3 of your week, with at least one rest day between, begin with a brief 5-minute warm-up, gentle walking in place, arm circles, leg swings. Then perform wall push-ups, 3 sets of 8 to 10 repetitions with 1 minute rest between sets. Rest 2 to 3 minutes. Then perform chair squats, 3 sets of 8 to 10 repetitions with 90-second rest between sets. Finish with gentle stretching of worked muscles. Total time, approximately 20 to 25 minutes per session. As you progress over weeks and months, gradually increase repetitions rather than rushing to add sets or difficulty. Once you can comfortably perform 3 sets of 12 repetitions with good form, then consider increasing difficulty through the progression options mentioned. Additional supportive practices. Exercise provides the stimulus for muscle growth, but several other factors support this process. Protein intake: older adults need adequate protein distributed throughout the day. Aim for 20 to 30 grams of protein at each meal. Good sources include Greek yogurt, eggs, chicken, fish, legumes, and tofu. If you struggle to eat enough protein through food, speak with your healthcare provider about whether supplementation might be appropriate. Adequate sleep: muscle recovery and growth occur during sleep. Most adults need 7 to 9 hours, though individual needs vary. Quality matters as much as quantity. Hydration: muscles are approximately 75% water. Proper hydration supports muscle function and recovery. Aim for adequate fluid intake throughout the day. Recovery time: muscles need rest between resistance training sessions to repair and strengthen. That's why we recommend 2 to 3 sessions per week with rest days between, rather than daily training. Important limitations and when to seek help. These exercises are valuable tools, but they're not complete solutions for all aspects of aging and health. They won't prevent all age-related changes. They complement but don't replace cardiovascular exercise like walking. They don't address all aspects of fall prevention. Balance-specific training, vision checks, medication reviews, and home safety modifications are also important. And they may not be appropriate for everyone without modifications. You should consult a physical therapist or healthcare provider before beginning if you have significant pain that limits movement, recent surgery or injury, complex medical conditions, severe balance problems, or if you're unsure whether these exercises are appropriate for your situation. A physical therapist can assess your individual needs and provide personalized modifications or alternative exercises if needed. Realistic timeline and expectations. Strength building is gradual, especially after 60. Here's what's realistic: weeks 1 to 2, you're learning movement patterns, building confidence, possibly experiencing mild muscle soreness. Weeks 3 to 6, movement patterns feel more natural, you may notice some functional improvements, you may be able to progress to more challenging variations. Weeks 8 to 12, noticeable strength improvements in daily activities, you can likely perform more repetitions or more difficult variations, and confidence in your physical capabilities may increase. Months 3 to 6, continued gradual improvements with consistent practice, maintenance of strength gains, potentially reaching your individual strength plateau, which is fine. The goal isn't endless progression, it's reaching and maintaining a functional strength level that supports your desired activities and independence. The broader context. These two exercises are valuable components of healthy aging, but they exist within a broader context. Maintaining strength after 60 supports functional independence, confidence in daily activities, better balance and reduced fall risk, and maintained ability to participate in activities you enjoy. However, overall health also requires cardiovascular activity like walking, balance and flexibility training, social connection and mental engagement, adequate nutrition and sleep, and regular healthcare and appropriate medical management. These exercises are tools, important tools, but not magic solutions. They work best as part of a comprehensive approach to healthy aging. Thank you for watching. The key takeaway is this: resistance training through exercises like wall push-ups and chair squats can help maintain and build functional strength after 60 when performed consistently, safely, and as part of a broader healthy aging approach. These aren't miracle movements, but they are effective, accessible tools for supporting the strength that enables independence and confidence in daily life. If you have specific concerns about your strength, mobility, or fall risk, consult with a physical therapist or healthcare provider who can assess your individual situation and provide personalized guidance. Consider subscribing for evidence-based guidance on movement and healthy aging, information that's realistic, practical, and rooted in research rather than hype. Strength after 60 is achievable and valuable. It requires consistent practice, patience, and realistic expectations. But it's absolutely within reach for most people with appropriate exercise and support. Take care of your body with thoughtful, informed choices.